Okay. Welcome to our second webinar in our three-part series sponsored by the Rutgers Institute for Corporate Social Innovation, aka RICSI, the Rutgers Business School's executive education and supported by PwC. I'm Gina Wurtenberg, and today our focus is on health equity, the role of business in building healthy communities, and we have some amazing speakers lined up on our panel. In a moment, I'm going to turn over to Erin Byrne, our wonderful RICSI executive in residence, who is co-moderating our session today with me. Erin has deep expertise, experience, and background in health equity. A couple of housekeeping items to note. You can chat your questions at any time, and we will be monitoring them throughout, and also saving time for Q&A at the end. If we call your name, you can feel free to unmute yourself to ask your questions. Erin?
Great, thanks, Gina, and hello, everybody. I think we hit the noon mark, so we can officially say good afternoon. I'm really excited about this panel. As Gina said, that we have wonderful experts from two healthcare companies, BD, or Becton Dickinson, and Bristol Myers Squibb, or BMS. Now, this panel discussion is actually a follow-up from the RICSI Inclusive Impact Summit that we held this past March. We did a panel then on health equity, but then it really focused on health equity, taking a look at it from a research perspective, as well as a foundation or a nonprofit perspective and how they're working to address it. So we're going to build on that today and take a look at how corporations or companies are focusing on it, why they're focusing on it, and how and why partnerships are a really important aspect to having, successful impact in this area. So before we jump in, we have just a couple of slides that I want to go over just to take a quick look at some statistics and information to kind of set the stage for today. So you see the agenda there. Already talked about the first one. Second one, we'll just talk about kind of laying the foundation for health equity and how that's different from health equality. We'll go over some statistics, talk about the role of the private sector, and that'll lead us really nicely into the discussion with three leaders in the private sector on health equity. So health equity versus equality. So I love this infographic. I actually found it from the Robert Wood Johnson Foundation and an effort they have around promoting health equity. So the difference between the two, right? If we take a look at that top part around equality, I think this visual just lays it out really nicely, right? Equality is that everyone's given the equal opportunity or equal resources. And in this situation, in this picture, it's that everyone, despite their differences, was given a bicycle. Now, health equity takes that a step further and makes sure that those resources are actually attuned and tailored to individual needs, right? So in that second line there, you can see that everyone got a bicycle, but it was one that was suited to them as an individual. And that's really what health equity is about. And on this next slide, we'll get into a little bit more of a definition here. So the way that the CDC defines health equity is that everyone has a fair and just opportunity to achieve their highest level of health. They also state that no one should be disadvantaged from achieving that potential because of their social position or other socially determined circumstances. So the little icons around that quote are to really put a visual on social determinants of health, right? So health disparities, social determinants of health are all factors that affect health equity. So if you look at where your neighborhood is, where your workplace is, do you have access to healthcare? What's your socioeconomic status like your wealth and your education? But what does this really look like in practical terms? We can take a look at some statistics here, taking a look at racial and ethnic health disparities. And the slide here just points out how some of these minority groups really go through, harder situations when it comes to their health, lower life expectancy, higher risk of kidney disease, lower health insurance. And if you take a look at the next slide, we'll talk about overlaying that specifically with the pandemic of COVID-19. So in this situation, you see minority groups, and they are 2 to 3 times more likely to be hospitalized with COVID-19. Why is that? Well, this one study took a look at that, and possible factors in this situation were that a lot of this population and these minority groups were more likely to be working outside of the house in a service industry. So if you thinking back to lockdown and just even then beyond, where the majority of everyone was, at the height of staying inside and working from home, but these individuals were going outside the home, thus putting them at risk in their employment for catching, coupled with the fact that they have lower health insurance as well. So just bringing that to life a little bit more. But what can we do about it? So the next slide, this is a good infographic that I like from the CDC, but talks about paving the road, right, to better health equity. And we really must change the systems and the policies in order to give rise to that equity that all individuals need in order to live the best lives that they can and attain their highest level of health. But how do you do that, right? It's a large, daunting task. Well, if you take a look at those three lanes there, those three roads: programs, measurement, and policy change. And those with us today, the three individuals that we have on the line, have deep expertise in those areas. So we'll dive into them in just a minute. But how does the role of the private sector play into all of this? Why do we have these three leaders on the phone with us? And Deb, if you can go to the next slide for me. Just talking about the role of the private sector, I love this quote here. And this is a white paper from the de Beaumont Foundation, the Bipartisan Policy Center. They did a white paper taking a look at the codependencies of businesses and communities. We will include this on our resource guide as well after the program today. But they really just talk about, there really is this codependency between corporations and the communities that they live in. And think about that, right? Communities need businesses to bring the wealth and the economic stability and employment to their communities. But on the flip side, businesses and corporations really need healthy communities because they need healthy individuals to become employees at their business. So there really is this codependency between the two. With that being said, I would like to introduce our panel here. And I'm going to do my best because admittedly for some reason, the slide is very small on my screen. So I'm going to do my best. And if I skip over something to Ellen, Jess, or Manan, please excuse me, but I will do my best here. So Manan Shah is with Bristol Myers Squibb, and he is in a newly created role there around being the VP and the global head of health equity and partnerships. He's got real deep experience within the pharmaceutical sector, over 15 years, and he has been with companies before that with Biogen, Leo Pharma, and Novo Nordisk, where we crossed paths many, many moons ago. And I can also tell you that he is a professor with Fairleigh Dickinson School of Graduate Public Health. So he's got a lot of deep expertise on this topic of social determinants of health. And Jess Johnston is with Becton Dickinson with BD. And Jess, I'm sorry, I'm forgetting the title that you have here and I cannot read it.
It's Senior Director of Global Community Affairs.
Okay, perfect. So thank you for that. And I know you have been with the organization for about 8 years, and your current role supports global operations and integrated supply chain teams. So we are really looking forward to your discussion with us today. And then also Ellen Rafferty is also with BD, and she leads a lot of the international and national corporate giving programs and their signature philanthropic program of building healthy communities. I know you also lead the disaster relief efforts, and we were just chatting about that beforehand. So thank you all for joining us today, and I am really excited to just jump into the conversation. But I would like to put it out to all of you, all three of you, and start off to say, why is health equity important, and why is it important to you both personally and professionally? So maybe Ellen, could we start with you?
Well, health equity is, I think in the last 2 years, the awareness around the inequities in healthcare have just been so prominent. And I think we discussed this yesterday, that our giving programs, I feel like, have always focused on health equity. It just wasn't the buzzword at the time. But I'm so glad that it is so prominent now, and that everybody is thinking about their programs and their approach in this different lens. So I think the impact will be so much stronger in the years to come.
And just to build off Ellen's comments as a fellow BD associate, we're one of the largest medical technology companies in the world. And while we've been focused on the pandemic response for the last 3 years, we are back to our plight to innovate in a way that meets the needs of everyone, regardless of where they're from, where they work, where they live, what their background is. But to me, innovation is of no use if it doesn't reach the people that need it. And I think that's part of our guiding purpose of advancing the world of health here at BD. And I think that's where we're going to dive into the discussion here today. So thanks for the opportunity. And it also dovetails nicely, Aaron, to the slide that you flashed up there too, about the difference between equality and equity. I think that's really where the rubber meets the road for us.
Yeah, absolutely. Perfect. Thank you. Manan?
Yeah, and first off, thank you for the invite to speak here. As a proud Rutgers alumnus of the Blaustein School, it's great to be back and contribute to this conversation. I mean, look, I would say what Jessica and Ellen covered, from the professional side definitely resonates. I think for me, from a very personal side, I've seen the impact of health inequity, both in the United States and in other parts of the world. I have family in India, and I've traveled extensively. And when you see firsthand what the limitations are, or what happens when people do not have access to the healthcare that they need, I mean, it sticks with you, it resonates with you. And I think the flip side of that is, looking around and saying, well, what can we do and how can we really address this? So for me, it really comes from a very personal space of it's available, it's out there. Our job as being experts or professionals in this field is figuring out how do we deliver it to those who are less fortunate or unable to receive access to care right now, and ensure that they do have it moving forward.
Yeah, that's really important, right? And I think that's part of what you were brought in to BMS to do. I know that BMS has committed a lot of funds and commitments to advance health equity across the past few years, and they've even carved out these functions like yours, which are new, right, to fight it. So can you continue to expand on that around what the benefit is from a company perspective to having a dedicated function and personnel like yourself and your team focused on health equity?
Sure. And as Aaron alluded to, so I've just started at BMS. I've been here for less than 2 months. But the commitment to health equity started years ago. Back in 2020, there was an announcement of $300 million for diversity and inclusion and health equity efforts, 150 from the company and 150 million from the foundation. But what we realized was that, after the excitement, after the press release, after the fanfare, that's when the real work begins. And you need to roll up your sleeves and really have that committed engagement, that long-term planning and that accountability as well. And so the value of a role like this and ensuring that there's personnel dedicated is to make sure that it stays front and center, and that there is that ongoing commitment that remains year after year, budget cycle after budget cycle, and making sure that whatever KPIs and metrics that have been announced at the beginning, there's that accountability factor that comes with that. And so having the interviews I did to get to this role and the onboarding, the area that I've really identified that I need to focus on is that dedication, that focus, making sure that if you want this to be an enterprise-wide effort, there's going to need to be someone at the front of that parade, or making sure that everyone is rowing in the same motion and the same direction, and we're achieving what it is that we've set out to achieve.
Yeah, I think having that internal champion, whether it's on health equity or even other topics, is proving to be a really, really critical area and really necessity, right, for moving things forward within companies. Now, not to dive too much in to, what you're doing on a day-to-day, because I know you're still building that strategy for yourself. But if you can just touch on and maybe even pull from some of your previous experience or things that you might be scratching the surface with around programs and partnerships and why they are important to, have a company or a private sector fighting health equity.
Sure. And so I think that, once you say that as a company, you want to engage in this space, fantastic. Then the question becomes, how do we do it? And you start identifying these programs, these partnerships. You realize that if you look in the communities you want to target, there's already a lot of people doing that work, and they oftentimes have more knowledge, more experience, have been on the ground longer. And so with that comes this sense of lessons you learn along the way. Oftentimes there can be, if I'm quite candid, a hubris or a confidence of being in private sector saying, well, we know best, we have the best folks, we have strong resources and budgets. But the lessons learned from partnerships is actually quite the opposite. You need to bring everyone to the table. You really need to come with a sense of humility and humbleness of acknowledging that there's people who've been doing this a lot longer, more extensively and at a deeper level, and they need to be there, and you need to hear from them what's worked, what hasn't worked, what it is that you can really contribute. With that then comes the total trust. There can't be any separate agendas. You can't be going into this thinking, oh, well, if we do this, there's also this side benefit and so on. There has to be that transparency involved. And then the two other things I would say, and we'd love to hear from Jessica and Ellen on this, is there has to be that commitment. There has to be that engagement that goes beyond just a calendar year or a budget cycle. If you really want to make an impact, you have to figure out, well, what is our longer term game? What is our strategy in this space? And on the flip side, then also really, once you set up the metrics, once you get things going, what is the strategy to either exit, transition, move this to another partner to take over or to handle? I think that, again, there's a lot of excitement at the beginning of launching a project or a partnership. I think as it gets towards the middle and the end, there's always a sense of, okay, well, what's next? And what do we do after this? But you really need to have this broad, whole-scale commitment beginning to end to really ensure success.
Yeah, absolutely. And I think you said a lot of key things there. And I know Ellen will touch base on some of, pulling through and expanding on those. I mean, just even on the idea of listening, right? Especially to your stakeholders, when they're a partner is absolutely critical, and that sustainability. How are you going to make this sustainable? Jess, what do you think? Anything to add to that? I mean, I know that you've been leading the efforts for BD in addressing the pandemic, which was a Herculean effort, I think. But do you have anything to build on from that?
Yeah, no, well, first of all, great comments from my colleague, Manan. And I think from my perspective, the pandemic really revealed, some challenges that we need to work on from a health equity perspective. And I can't think of a better example of how this played out in real time other than vaccine deployment. BD is the largest producer of needles and syringes in the world. And I'm pleased to share that we manufactured 2 billion extra needles and syringes to support vaccination globally, on top of what we normally produce for routine care. And when we set out to do this in March of 2020, we didn't have a lot of time to think about, and I'll be honest, none of us, the government, BD, our vaccine partners and others, we were asked to mobilize an effort, in a very limited amount of time. And there was some things that were skipped over. I think, what I'm proud of though, is that we learned along the way, and built that trust and loyalty to what became an incredible effort here in the US, where I think, we're still lacking, candidly, and you've been reading the newspapers, I'm sure, about vaccine hesitancy and challenges in other regions of the world. But not everybody got the same level of a response in terms of vaccine deployment as the US. And so I think there's the component of equity, but also equality there too. And I think, the pandemic revealed, areas and gaps and opportunities that the policy landscape can now help shape. But the trust, one thing I wanted to highlight about the previous comments made about programs and partnership, but the one thing that we really all learned through this is that if you don't have trust and loyalty built with the communities, you can have the best program, you can have the best medical devices and innovation, but if you don't have that trust and loyalty, it's very hard to mobilize an effort. You often hear the term all politics is local, and it's really true. But what drives that saying is the community. And I think, again, we have this tremendous opportunity now to take those learnings, to be honest about what transpired, look at those gaps, and again, drive purposeful policy to support those programs and partnerships that we're all trying to evolve here, following, what's been a very, very challenging 3 years.
Sure. And, just to hone in on that trust, and this is something that we've talked about before, but the industry, the healthcare industry, the biotech, the pharmaceutical industry sometimes get a bad rap, right? Bad name. But did you have any issues with partnering with the government around that time? Or was it just given that the need was so great there, and that the partnership then and the trust then just came naturally?
It's a great question. I am proud to say that the partnership that we had with the government and all the stakeholders that came to the table was incredible. And I'll say that for the U.S. I'll say that for regional stakeholders beyond the outside of the U.S. as well. The pandemic actually allowed some of those guardrails to come down, and even some elements of policy that I think stand in the way from accelerating an effort, those came down as well. And the silver lining to me is that we came together quickly to do amazing things. Did we do everything right? Probably not, but that's okay. We did it, to your point, a Herculean effort in a very an accelerated timeline. But I think that just to hone in on one really important element here, to me, it's not about the government or companies or stakeholders or the people, the patients that we're trying to serve. Everyone had to come together to make this happen. Not one entity could have done this alone. And I think, that is the key learning. That is the silver bullet that I think we all need to hone in on here from a policy, programs, and partnership perspective moving forward.
I think you hit the nail on the head there too, right? And whether, we're talking about COVID and vaccine efforts or something else within health equity, this is such a large topic. It's a multifaceted topic when you look at all the different factors that go into it, right? When we talk about racial disparities, when we talk about social determinants of health, and to your point, there is no one stakeholder who can do it alone, which again, I think just rounds out that idea of why partnerships are so critical to having success and impact here. You brought up policy a couple of times. So talk to us about that. How did policy play a role in the efforts that you led around the vaccine deployment?
Sure. So, there have been preparedness policies in place for quite some time, and elements of that addressing health equity and social determinants of health. I think, during a crisis situation, there's only so much that you can do with the time and expansive effort that you have underway. But I think during the pandemic, there wasn't much of a playbook in policy necessarily to make decisions in real time like we had to. But again, it's taking those learnings now and developing the policy based on real life examples of what happened, what transpired, what were the gaps. I think that's the real opportunity in terms of shaping policy moving forward to ensure that, health equity remains a top priority as we innovate and ensure that all patients have the access that they deserve to technology, whether it be during a pandemic scenario or from a routine care perspective. Again, we have that opportunity now to really take examples and truly evidence now and translate that into policies that will change the way we look at preparedness. But I think in general, healthcare is way we're looking at it is shifting as well. You're seeing sites of care shift coming out of the pandemic. And I think you're seeing that because of a health equity and patient access perspective. And you're also seeing payment mechanisms, I think. That's when you know it's really starting to stick, is when you see the payment aspect really drive decision making in terms of health equity as well. So I'm pleased to see that shift, that mind shift is happening. And again, it's because of the learnings coming out of the pandemic. Not necessarily those were driven by policy, but it's driving the policy that's going to shape the future of healthcare today.
Yeah, I think that makes so much sense. And I do know a lot of times policy is like a key performance indicator when partnerships are established a lot of times, right? Because there's a lot of advocacy aspect that goes around it. But Ellen, I would love to get to you in just a minute on taking that from a national perspective down to a community. But before we go there, I just want to give Manan an opportunity to chime in here, because I know that you've worked both in the US and internationally around policy, healthcare policy, if you can build on or add to what Jeff said.
Yeah, I mean, I think I view policy as that longer term commitment, because that, ultimately, no matter how big or robust a program or initiative is going to end. And okay, so what? What have you achieved? And I think the focus on policy is taking any of the lessons learned, perhaps data collected, and being able to, formalize it or utilize it to ensure that you make some change or some impact. And so what I found, whether it's been in the US or whether it's been in other countries, getting that engagement from government officials and the policymakers is essential, because you want them to see firsthand the work you're doing, why you're doing it, what it's achieved, but then also have them leave that imprint in their minds of when they are the ones who are able to create policy, vote on it, appropriate budget to it with whatever is approved and passed, then they understand the why behind it and it resonates with them. And especially in the case of health and addressing health equity issues, that's a very visible impact that can be seen. Oftentimes it can be seen very quickly. And it's not something that's going to take 5 or 10 years to have results, reveal themselves. So yeah, I think policy is that longer lasting commitment of what happens, after those partnerships are over and after you've declared success internally or you moved on. That's what remains to ensure that, for the patients and the communities that you're working towards, there's something longer lasting for them. Yeah.
And you both touched on individual policymakers, right? So Ellen, let's get this down to a community level a little bit. First, before I jump into the bridging the policy aspect too much, if you can just talk about the program that you lead to give everyone understanding of that, and then we can go a little bit more into the details.
Sure, thanks, Erin. So the program that we're going to speak about today, and there are several around in health equity, but it's a partnership with Direct Relief and the National Association of Community Health Centers, which we started in 2013. It was our first branded program where we have the BD name associated with it. And it is it's a competitive grant program providing grant funding to the federally qualified health centers in the US. It's a national program, and it's helping them meet the gaps. It's providing funding for centers showing innovation. So that's not something that's easily funded. In many cases, you kind of have to show that proof of concept before someone is willing to support you. And I see our friends from Zufol are on here. One of our first award winners and a 2-time grantee. And the program has been going steadily since, and it's constantly evolving. We're always tweaking it each year. We're actually in year 9 now, so it's coming up on a 10-year commitment, and it's really shown some considerable impact and strong measurement and evaluation, and mostly centered around diabetes and blood pressure. So if you can reduce someone's blood pressure and their A1C, there is a cost savings that's correlated with that, and I can get into that a little bit more. But yeah, something we hope to continue to do, and this program has led to several others with the Free Clinic Association and other partners as well.
Yeah, it's really tremendous about what you're doing. And I think, you talked about so many things I want to get into around measurement and just involving and understanding the communities and giving them funds to build on the innovation that they started. But to kind of circle back real quickly to the policy component, I think Jess, you even said yesterday, policy does nothing if it's not activated within the community, right? So Ellen, can you talk a little bit about how you activate that policy, how you engage even local policymakers, and why that's really important for all of your stakeholders and the initiatives that you're trying to raise awareness on?
Yes, and that is, it is all about raising awareness of the work that's going on in their communities. So with the help of folks on Jess's team, we've been able to engage many congressional reps throughout the years at the centers that they in the communities where they represent, and it really just helps tell that story. It makes them feel empowered because they can share the information and hopefully they can influence policy about either continuing the funding for the centers, or in particular maybe the role of the clinical pharmacist, which we can talk about later on as well, which is not something that's currently a billable event, but if you can show that the model is working, maybe that is something that can be changed in the future. So a lot of elements there that just including them helps tell the story, helps tell the broader story, and helps them be that champion for the centers.
Yeah, that's, I think, critical. Jess, do you have anything else to add?
Yeah, I mean, I just wanted to highlight this. It's really amazing when you can see the policy translate into something tangible and local, and what Ellen and in partnership with Direct Relief has been able to do through this program is just that. When we engage members of Congress or local elected officials to engage, it's really to bolster and highlight the partnership. I think there's definitely general awareness that community health centers are in these communities, but I don't think there's an awareness on what they're actually trying to accomplish, what the barriers to success are. And so, I think getting back to the discussion about the importance of policy and the fact that it's no good if you can't actually, do something with it. This is actually not just showing evidence, but it's continuing to highlight those barriers to success. And then it's further defining the program. Obviously it's evolving. And I think it gets back to Manan's really good point about trust, loyalty, but also not making it a one and done exercise. We want this to be a continual effort that evolves with the landscape and with the need. And to do that, you really need to, just to bring it all back home here, you have to have the partnership, you have to have the support of the community, but also those in Washington that are looking, that are making these policies that are addressing these barriers to success and ensuring that we're connecting the dots and, again, evolving in the direction that these patients really need. That landscape looks very different now than it did 3 years ago. And so
Sure.
we need to be considerate of that.
Yeah, and I think just to your point, bringing their local officials to the community health centers or the clinics and the pharmacies in their own home state and home region is really important, because without those conversations, they're not going to know what's happening in the community. They're not going to know the importance of the constituents that they're representing, right? And while there may be, state level policy change that can happen, it does go all the way up to the national level, right? So, I've been at meetings on Capitol Hill and they want to know, right, what's happening with their constituents. It brings it home, I think, so much more clearly for them when they can understand that versus just talking to them about, a blanket bill that's going across the United States.
Well, I think just to add there, Erin, earlier in my career, I was a lobbyist for a company, and what I'd always try and explain to people who say lobbying is, a bad rep is in the current Congress, there's only 17 members of Congress who are physicians. Maybe a handful who are nurses or have some other health related background. You're trying to influence people who are going to be making decisions who may not necessarily have the background to understand fully what it is that they're going to be voting on. And, you know, Congress is run by an ever-changing sea of 20-something-year-olds, and there's plenty of legislative aides who will brief them. But to your point, Aaron, yeah, they want to know what's going on. They want to know what their constituents need and what's going on back home, as it were. But you're also engaging with stakeholders who just that fundamental awareness of concepts like health equity, access to care, you know, they may not have that. So it's also a responsibility to have of educating them, helping explain to them why this is important, why we're doing this, why they need to support policy efforts for the benefits of their constituents and their districts back home.
Yeah. Absolutely, absolutely. So I think it gets down back to Ellen with this idea of these, you know, place-based initiatives, and that's exactly what you're doing and leading BD's helping build healthy communities initiative. But I also just want to talk a little bit more about that program, right? You talked about measurement, you talked about impact, and I know that some of the grantees from your program are really focused on that, and you've even rewarded them with that, with giving funding, you know, in consecutive years. If you just want to give the audience a little bit about maybe why, from a business decision, you decided to do that, and the impact that you're seeing that they have. Oh, you're on mute.
So sorry, I was coughing. Just a little background on the program in its current form. It's providing funding for clinical pharmacists to spend one-on-one time with the patients to go through their medication. And it's and just to give you a little bit more background as well, the health centers, just the demographics of who they're serving. So 20% are uninsured, 90% are low income, and 65% are members of racial or ethnic minority groups, and 42% live in rural communities. So the time for the pharmacist to spend with the patient, as I mentioned earlier, is not a billable event, but it is a critical role, and the trust is built there. Sometimes they feel more comfortable talking to the pharmacist than they do to the doctor, and they do get to spend more time with them as well. What else can I share with you here? The measurement and evaluation piece has been quite strong, and it's really, you know, filling that gap. Something that we hope to continue to grow. You know, I lost sight of your question. I'm so sorry.
That's okay. That's okay. I think we got thrown off with the muting, and I'm sorry if I caught you mid cough. But from a business decision, why did you feel like it was important to fund some of the grantees who had already, you know, received funding from you in the past? And I think that probably gets into the innovation aspect, if I could guess a little bit.
Yes, that's actually new this year. We were thinking about how to change things up a little bit. So awarding them a second round of funding to help them to continue with this support, because they did show very strong results and reporting, and how the clinical pharmacist is an integrated part of the care team now in many cases. So for those 4 from the last 6 cohort.
Yeah, and let's go to the measurement piece for a second. I know that you have taken some of the work that has been executed from the funding that you provided along with direct relief, and turned it into a manuscript and got it peer reviewed and published. I think it's so critically important, right? Because you don't know how to build unless you have something to, you know, measure it against. And in this world of social impact, I think it's really hard to quantify the impact that we're having. And so if you can just speak to that aspect of around the measurement and the importance of getting some of that published.
Yes, it took quite a while to get there. We had to gather the data and, you know, really understand what the centers could provide and what they couldn't provide, which really kind of helped us shape our conversations and what we were looking for, because you always want to be mindful of not adding more burden to the organizations that are already providing so much support. So yeah, getting the paper written was huge, and bringing in the measurement evaluation consultant that we did, who's a pharmacist from Purdue University, and Direct Relief also has a pharmacist, Alicia Clark, who was key in demonstrating the impact, has really just told the bigger, broader story. And we knew we were doing something nice. We knew the number of grants we were doing and the money that was going into it and the product, but now we can show that these interventions are really improving health outcomes. And I think we estimated 20% lower risk of death in some cases by reducing your A1Cs and your blood pressure. So
Yeah.
we'll continue measuring and evaluating and tweaking as we go.
Yeah, and I think that also just gets back to that infographic that we saw on the slides in the beginning around, having a program, but also having measurement to go behind it, which then can help also affect the impact of policy, right? So, here we are coming full circle. And yeah, I have a printout here just of one of them and how some of the HbA1c scores decreased 1.2% in 6 months, which is really, really admirable. So clearly successful of that program. Not that I want to dive into this too much, but there was a chat that I saw come up just asking for other practical examples of other health equity in action. If you can just talk about how this program inspired you for BD to also look into some other programs as well.
Sure. So we knew that this was a big patient population. 30 million patients are seen at the federally qualified health centers, but then there's also patients that are seen at the free clinics in the US, which don't receive any federal funding. They operate with either a small staff or mostly volunteer staff, so they have to be quite nimble. So we had started exploring what it would look like to also support them, and we rolled out a program with AmeriCares for a patient-centered medical home, and we rolled out a program with Heart to Heart, where we're installing point of care labs in the free clinics. And that really speaks to some of the barriers of care and the social determinants of health for folks who would have to go across town and be referred to a lab or a hospital to get their blood work or other tests. And oftentimes that wouldn't happen just because they may work 2 jobs and transportation may be a challenge. So they're both kind of meeting the patients where they are, and addressing some of those, again, inequities.
Perfect. And I think what you did there too was you really understood the community, right? And I think that's something that's kind of been touched upon a lot, but Manan, if you can just, give us your thoughts on that. And I know you have some good examples around why the idea of understanding the community that you're looking to impact is so critical.
Sure. And I think I can hopefully address one of the questions in the chat of an example in doing that. When we look at patients, we often talk about, okay, well, what patients are we not serving? Are we not working with? And I know BMS has leaned forward in focusing on clinical trial diversity. And what we've said is that we want to ensure that at least 25% of US clinical trial research sites are in highly diverse communities by 2022. Well, in 2021, we hit over 50%, so that was a really committed effort, because you can say you need more representation, but how are you going to make sure that the people who you're trying to get into the trials are able to access them, are able to go and, because oftentimes clinical trials are long, depending on which therapeutic area or treatment they're looking at. It's multiple visits, long durations and so on. So we really address this point of, okay, well, how do we get to them? And we can't just say, well, they're not coming to us. We have to go into those communities. And then we took it a step further, because we said, okay, well, that's one step of it. But then there's also this notion of people are oftentimes more comfortable engaging with medical professionals who look like them or speak their language, understand their cultural and social backgrounds and norms. And so from the foundation side, we had opened up applications for what we're calling Diversity in Clinical Trials Career Development Program. And we said that in partnership with the National Medical Fellowships, we will train 250 diverse clinical trial investigators to help them understand how to run, and be engaged in these clinical trials, some of the cultural training and education that's required. It's one thing to say, hey, we need to do this. It's the other, and going back to the questions of strategy and focus and commitment of really pulling in all aspects of an organization, whether it's clinical trials, whether it's legal, whether it's medical, and really having this coordinated effort across the board. So I'd say that that's one example of health equity in action.
Jess, were you going to chime in there?
I was going to build off that, and also in light of some of the questions coming into the chat too about, how are you really putting some, really taking this seriously and head on as a company. And I think, one of the things I'm proud of, well, first of all, we could sit here and talk about all the things that we're doing at BD and at BMS. And I know we're each doing great things. And I know a lot of our peers are as well, but we have to really address this as a community of companies. And so, I'm proud to say that, our CEO sits on AdvaMed's board. That's our industry association of peers. And, we have challenged AdvaMed and the community of our peers to come together to ensure that we're aligned on the principles. And just recently launched coming out of COVID. And again, speaking to those learnings and the gaps that were identified during the pandemic, we just launched a new set of principles. And I think that's really important to ensure that we're all in this together, that it's not one company doing one thing and another company doing another thing, but that we're aligned. We're all providing different aspects of technology and support to the healthcare community. And so we have the greatest chance of success to meet health equities head on as a community, and in the communities in which we reside, which is the other point that I was going to make, that, I think obviously a patient is behind everything that we do at BD. And I know the same goes for our colleagues at BMS and others. We wouldn't be in this business if that wasn't the case, but our best asset is our employees as well. And so we are rolling out a number of different programs to support their healthcare needs, to ensure that we're addressing equality and equity with them. If we can't do it with our own associates around the world, our greatest asset, then, how could we possibly translate that into equity in terms of patient care? So I think, not to say that we have everything set in stone yet, and we're learning and evolving obviously together, but very proud to say that BD is absolutely meeting the needs head on, starting with our employees first, and obviously with that patient-centered eye towards ensuring the future of healthcare really gets to the folks that need it the most, right? Again, to my point earlier on about innovation.
Yeah. And I think what you're both are talking to is, really important, because it's clear that you have that internal engagement and alignment on the work that you're doing. So Jess, thank you for bringing that up. And Manan, maybe I can just also ask you, can you discuss a little bit about how you're trying to advance an enterprise-wide strategy around health equity, and what's that looking like for you?
Yeah, I mean, I'm looking at Jim and Ken's questions in the chat, and they're great ones, because that's what I have to figure out. And so, if you guys want to come on board and help me out, I would welcome that. But I think it starts with that commitment from leadership, and we are fortunate to have a CEO who really, put his foot down and said, this is the right thing to do, not from a business perspective, but this is the right thing to do for patients and society. He's a physician by background, so he has that understanding, which is fantastic. But, it was only last year that BMS established a chief inclusion and diversity officer and placed them on the leadership team reporting into the CEO. So you start with changes like that, or commitments like that, to show that this isn't just, lip service, as it were, or a function that's buried, pretty low in the organization, trying to, get its voice heard. You establish that commitment from the top down, and then you challenge the rest of the organization to say, okay, well, what are you doing to contribute? And in that example, we've created some benchmark goals of diversity among executive levels in the organization, gender parity at the executive level as well. And, there's some benchmarks that are, put out there, and that there's a transparency to it. We report year after year, where are we against these benchmarks? Have we achieved them? What's the progress there? For me, one of the things that I'm faced with right now is figuring out what is that enterprise-wide strategy of health equity specifically, not inclusion and diversity, but this equity effort. How is it that we are going to ensure a more equitable environment for the patients that we serve and the communities that they live in? And part of that is it's a challenge. I'm not going to lie. If it was easy, then every company would have it, and it would be fantastic, and hopefully there'd be a whole lot less inequity out there. But what I'm finding is that it's almost a good problem to have, in the sense of you need to rein in a lot of excitement and enthusiasm different departments and teams have, because when the CEO says something, most people jump and say, okay, well, how high do you want me to jump, and what do you want me to do? And you got people running off in all sorts of different directions saying, well, we're doing this and we're doing that and this and that, and isn't this great? And the challenge there becomes you almost create noise or a buzz, and it's not very strategic or a enterprise-wide effort where, as I mentioned before, everyone is rowing in the same direction or marching to the same drumbeat. So it's a matter of harnessing that enthusiasm, excitement, but making sure that everyone is focused on the same pillars or 3 goals, or maybe these 2 social determinants of health, and that's what we're going to commit to. It's an ongoing process. I mean, I would love to hear if anyone has examples or things that they've done or seen, but this is the challenge and the task. And, quite candidly, this is what I'm going to be measured on. This is going to be my performance review this year and next year of how have I implemented this enterprise-wide strategy, and is it working? And are we seeing the results across the entire organization?
Yeah, and I think, something that comes to mind for me too is that this doesn't happen overnight, right? This is, as we talked about, this is like a very large task that we have ahead of us for all of us working to, for health equity. It can't be done alone. So for one company, and Ellen specifically, just taking a look at your programs, like, you're almost in 10 years. So that shows a large commitment, but it also shows that you need to be in it for the long haul. And it doesn't mean forever, right? But you need to be into it. You can't just pat yourself on the back and throw one role out there to say, oh, we filled X, Y, and Z role. You have to be able to be in it to show the commitment and then show the impact. And that also gets why I think measurement's important, to be able to then turn back around to leadership and show the impact for it. I think looking at Ken's question here, to keep the programs running, right? So I think it's a multifaceted aspect, right, for how companies continue to keep this as a focus.
Yeah, can I just add there, building on the issue with the clinical trials and bringing in that, diverse mix of people. I know we've been having early stage conversations with the Leukemia and Lymphoma Society about engaging doctors at the local level, maybe not in the big city, who will be performing the clinical trial, but to do, basic blood work, some other basic care for the folks that are participating in the clinical trial, so that the transportation issues are not another barrier, and to try to include them. So that would be probably a big approach, trying to include those doctors and get the buy-in at that level. But I think that shows a lot of promise.
Yeah, absolutely. So Gina, I know you're monitoring this chat much more closely than I am. Are there other components that we should touch upon?
Yeah, we had quite a few very interesting comments. Linda Kelly was asking, does and can health equity programs that educate about prescriptions also be coupled with nutrition education? Nutrition education access is often a missing ingredient in these communities. Anybody want to comment on that one?
I concur, and I'll also just go to Ellen to say, has any of your grantees been able to focus on nutrition? Because I completely agree with Linda.
Yes, I believe all of them are either they have gardens on site for their patients, or they can provide access to fresh fruits and vegetables. They're also in many places providing cooking classes that are culturally sensitive. So yeah, there's a variety of ways that they're addressing nutrition, because we know that's a big factor in trying to improve your health.
Yeah, that's so great to hear. Yeah, and I do know, Linda, that there's some programs actually happening within New Jersey, and from other companies that are really focusing on not just nutrition access, which I think is one critical component to understanding or being able to access fresh fruits, vegetables, etc., but also making them culturally relevant. It's no good if you give somebody a mango if they have no idea what it is or how to cut it. And then also giving them the education of what it does to, either treat or prevent disease. So
And
I
Eva-
personally am happy to see that.
Eva
yeah.
Turbiner raised a really important issue. She said, while the inclusion of underserved groups in clinical trials is admirable, certainly the historic maltreatment of people of color in medical research must be acknowledged and considered. Presumably BMS is working with community-based groups to ensure appropriate understanding and consent.
Yes, and I want to respond to that, to what Vicky said, to what Madhav said, because I think they all touch upon this theme. And I hope I'm not speaking for Jessica and Ellen when I say this, but you can't do this alone. As strong and committed and as large as organizations at BD or BMS are, you can't tackle these issues such as health equity by yourself. And I think you have, as I mentioned, you have to come from a place of knowing that there's others who are more experienced, sensitive, well-versed. And in our case, we partnered with Morehouse down in Atlanta, the Gulf South Minority Underserved Community Oncology Research Program, and 6-7 other host institutions to understand what it is that we don't know, how to, properly address and engage with these communities in need, and have them help us figure out how to reach out to them, connect with them. So yeah, I would say that we definitely aren't doing this by ourselves. We realize that there is a lot of historical, background and reasons that there's distrust or concern of engaging in clinical trials and such out there. And as Erin said, this isn't going to be done overnight. And if you're committed and have this, vision for a long-lasting relationship, that's the way that you're going to achieve any outcomes that you're hoping to focus on.
So
Perfect.
I see many excellent comments and even ideas here. We're going to capture the chat and we'll also post that. And in the interest of time, Erin, did you want to say anything else before I talk about next steps?
No, just thank you everyone for tuning in today. Thank you to our panelists and for a great discussion. So over to you, Gina.
Great. Well, thank you so much. This was really enlightening and valuable, and we appreciate all the comments. I wanted to mention that the next webinar, the third in our series, is coming up on November 4th, and it's going to be focusing on shared prosperity, leveling the playing field through inclusive upskilling, innovation, and entrepreneurship. We've lined up 2 and perhaps may have a third fantastic speakers. The first one is going to be Bhushan Sethi, a partner and joint global leader for people and organizations at PwC. He's quite the expert on upskilling and reskilling and a lot of the things related to shared prosperity. And the second speaker is Lanier Richardson, the executive director of Rutgers Center for Urban Entrepreneurship and Economic Development, CUDE, at Rutgers. And he was also recently appointed to the Brookings Institution as a non-resident executive. Fantastic background. Also, we will put on our website the recording, the PowerPoints that Erin shared, as well as a very comprehensive resource repository that we've created, focusing on helpful resources from Harvard, the UN, the Bipartisan Policy Center, FSG, the CDC, et cetera. Companies leading the way, including BDs that you heard a lot about today, and BMS, also Unilever, Novo Nordisk, Coca-Cola, Zufall Health, who's with us today, and also other things that have been in the news recently, including what's going on at the Robert Wood Johnson Foundation. Walmart has a major initiative, Amazon, and Deloitte. So thank you all for joining us today. We will post this early next week, and you can have a chance to watch it more. Reach out to us if you have any questions or comments. Thank you, Erin. Thank you, Jess. Thank you, Manan, and thank you, Ellen. We appreciate your participation. Thank you.
Thanks, everyone.